one in Brentwood, 2. So the rest were either died in their home or died in a hospital. They ranged in age from a man in his 30s to people all the way up into their 90s. And so our heart goes out to those families, of course, and to everyone who's suffering with this virus. 89 new cases today, so you're seeing pretty much a flat across the last 10 days, a little above, a little below 100 each day. So that is, somewhat good news. On the nursing homes, and Phil will go more into this, that is a big area of concern, as we've talked about before, because once these get into the nursing homes, it's real hard to keep it from spreading. So at Monticello West, we have one new case reported today. That brings us to 17 residents that are positive. There have been 2 deaths there. Then at Skyline, we've got 34 residents positive, 10 staff positive, 1 new staff today and 2 new residents today, and we've had 1 death there. At Edgemere, we're staying pretty steady on our numbers there. We've got 8 residents that have been positive total. 3 of those have since died. We got 2 staff that are confirmed positive. And then Reserve at Richardson, we have 8 residents that have been confirmed positive and 1 death. At Brentwood, we're up to 5 deaths now. At Brentwood 1, and again, that's 4 new deaths today. It's 40 residents, 2 new cases today, and 2 staff have been confirmed positive. At St. Joseph's, we've got 1 resident who's positive. At Villages of Dallas, 1 resident who's positive. At Brentwood 2, we're up to 10 residents confirmed positive, and that first death was today. At Winters Park Nursing and Rehabilitation Center, which is these numbers are from the Garland Health Department, there's 1 resident with a confirmed positive, 1 staff member with a confirmed positive. That's a Collin County resident, and there's been 1 death. Of our people requiring hospitalization, nearly 7 out of 10 have been people over 60 years of age, and about 30% of those have had diabetes as they're under, or diabetes, as you city people say, as their underlying high-risk health condition. So if you have that condition, please be very, very careful out there. I think these numbers illustrate that we are in the middle of this, okay? And although the curve is flattening and you're getting good news every day about the impact of your good choices in following social distancing and the positive impact that that's having. And I know people are, tired of being in their homes and wanting to take those rays of good news and go out and loosen up on these standards and maybe have a party or go visit at a friend's house. But it's really, really important if we're going to be successful, if the sacrifice that you've already made is going to bear fruit so that we can get back to normal just as soon as possible. It's very important that you keep making those good personal decisions, keep doing what you're doing so well, keep flattening that curve. We're looking at a peak now that is either at the end of this month or maybe it's the beginning of next month. So it's coming up on us fast. I cannot stress to you how important it is that you don't let off now and you don't say, because we're getting some good news from the medical field, that it's time for me to spend more time around people, because that's the opposite. The reason we're getting good news from the medical folks that you're flattening the curve is because you're making good personal decisions, and we've got to keep making those. I don't know, a little bit of good news, by the way, I don't know if this will pop up or not, because I don't know how that works, but if there's a graph for Goldman Sachs, somebody's got that? All right. So I want to give a shout out to Goldman Sachs Gives Fund. They made a $250,000 contribution to our Dallas County COVID Response Fund, which was established to secure critical resources like sanitizer, personal protective equipment for our frontline responders. Our frontline responders bravely show up to do their job every day. When we have partners like Goldman that understand that and help, it makes a huge difference. And by the way, the money that you give to that fund, that money it basically is quadrupled because we use that money, we put it with other money, and that's used to buy PPE. So if you give $1, and sometimes sanitizer and other things that our first responders and hospital heroes need, when you give $1, it basically becomes $4 because of the way that the FEMA funds work. So thank you everyone for doing that. If anyone wants to give money like Goldman did, large and small, that's at dallascountycovid.org. Some other good news, that's why I'm a little late getting this conference day. I was in a phone meeting with Nim Kidd from the Texas Division of Emergency Management. Nim and I have been through a bunch of disasters together. So we successfully got the rules changed. Tony Robinson, I mentioned this at another press conference. Tony and I and the person from California, who's the FEMA person from California, were successful in lobbying to change the rules so that now the federal money can flow to the food bank. So in Texas, we have the North Texas Food Bank here. It serves 13 counties. By the way, you can give to that with our neighbor-to-neighbor virtual food bank by going on this Dallas County COVID. We're going to @NTFB on Twitter and Facebook. But even with your giving, and you've been great, you've given like $250,000 since we started the virtual food bank last Sunday. But even with that, we're about $3 million short on just getting enough food into the food bank to take care of the incredible demand that we have for hungry people. 70% of the people who are hitting the North Texas Food Bank have never gone there before, right? And since COVID started on March the 10th, the people that are there now, 70% of them, brand new folks, right? And so that's depleting down that food bank. So with the change in the federal rules, we can get that $3 million, and the food should get here in 2 to 3 days. We're discussing whether or not that is a cash or whether the state sends 18-wheelers, but the federal money will flow through the state. That'll be worked out, and the food bank will get that help. And so, I want to thank Nim and everyone who's working on that with us for making that happen, and especially Tony for his great lobbying efforts. Tony Robinson with our FEMA Region 6 coordinator for Texas and the surrounding states, because that's going to be a big help. And it's not only going to help, that's not only going to have an impact here in North Texas, that's going to have an impact on 21 food banks throughout the state of Texas. So in San Antonio and El Paso and Houston, those food banks will be getting those resources too. And that's really going to help a lot of hungry people. So that is very good news. As I mentioned, we reported 89 additional positive cases today. I didn't see I'll have to check it out later, whatever they came up with for Goldman Sachs. Anyway, we have reported 89 positive cases today. Phil might have some more information on that. And Peter's here if anybody has questions about unified healthcare response when we start answering questions. Peter, Phil, you want to come up and I'll move over here.
So as the judge mentioned, 89 new reported cases today, 1,877 total. The 10 deaths today is the largest single number that we've had in a day. And also, those represent, there was a person in their 30s, 3 people in their 50s. Just really emphasizes the seriousness of this and why all these actions are so important. Probably these deaths represent maybe infections that occurred a couple of weeks ago. That's where we can expect perhaps that these might continue to increase for a while. But as the judge mentioned, there's really good news from the standpoint, definitely all of the orders the stay home, stay safe is making an impact. It is slowing the infection rate. You're seeing a lengthening of the doubling time of these numbers, and so it's working. But all of the projections, all of these are dependent on everyone continuing to vigilantly adhere to these. So again, it's good news, but we have to keep on task with that. I don't know if we were going to show the map just to see. Again, we're continuing to update that, and there is now an interactive map that you can see both by zip code and the city numbers, and see detailed numbers on those. But there are, when you look at zip code, there are a couple, very hotspots noted in there. I mean, some of those reflect some of the clustering at the long-term care facilities, but some others that we're still looking at, I think the 75115 area seems to be a little more dispersed and not clustered in one place. So we're trying to look at that. Again, we have people that are trying to go out there, do more education, and work with the stores and others, make sure that they're supporting and promoting the physical distancing and those sorts of things. But again, this we're continuing to look at this and see what information it tells us in terms of efforts that we need to do to continue to keep preventing this. So I think that's probably.
Yeah, a couple other things. Since we are, a lot of work today, and so not a lot of notes. A couple other things that we may not have talked about with you that are, big game changer things if we can get this to happen. One of the things I was talking to the state about before coming in here, we've got a STAR request into them. I want to give you some visibility into testing, okay? So you've got the testing that happens with the private labs, which, by the way, far outstrips your government testing right now. Okay, and then on the government testing side, you have 250 maximum at Ellis Davis, 250 maximum at AAC, about a 120 at Parkland. The reason one in Parkland is the one that's over at Amelia Court, that is the county facility that's not the 2 drive-throughs, but the one that services Parkland patients. The reason that that's 120 is because the amount of reagents and kits that we have will only let us do an average of about 120 a day. We have the people power and the machines to do 1,600 a day. So we're working with the state to get those reagents and those kits. You get those, and there's an extra 1,500 a day, and those are one-day turnarounds. The Parkland machine is a one-day turnaround machine. The 2 federal sites are like 7-day turnaround machines. And so that's a big visibility help. You look over here at DeSoto and you see what's happening. That's what I told you I feared would happen. The 2 things that we're seeing, the 2 bad trends that we feared happening are the things that, you could see were likely to happen because they happened everywhere else that's ahead of us, right? You're seeing it spread through nursing homes, and you're seeing people die with that. And then you're seeing it get into neighborhoods and turn them into these darker colors like it's happening with DeSoto right now. The key thing, nursing homes is a little different. Testing is important for both. But the key thing to protect the people in DeSoto and the areas that are going to fall into that category and worsen if we don't get testing is testing. Okay, testing is what we desperately need right now. So working with testing has become the biggest shortfall right now, more than bed capacity. We're pretty good on bed capacity right now. If we had a wand and we could wave it, we'd get testing. So that's 1,500 more tests if you just get Parkland. Now, if you get those same reagents to UT Southwestern, it's another 1,440 a day. You get 3 more machines at UT Southwestern that we'll pay for if you can just get us, if the feds will just sell them to us. You get those 3 more machines, and that's another 5,000 at UT Southwestern on about a 1-day turnaround on those tests. So you go from 121-day turnaround test capacity on the government side that we have now to 6,720 1-day turnaround test if we can get this STAR filled. And it's not easy to do. It's not like the state and the feds won't try to do it. But with each little piece of that, we can exponentially move that up. And then you still have your 500 7-day turnaround test at the AAC in the Ellis Davis. So that's a big thing that we're working on. I'm hopeful that we'll have some good news on that. With the one other thing before we take questions, with the military doctors that would be at the KBH, right? Those doctors are now also doing work in our hospitals. They're helping in our hospitals with our COVID patients, and so we appreciate their services. We appreciate the service of every person in the hospitals and out in the healthcare community that are putting their lives on the line to keep us safe. And with that, we'll take questions from anybody. Candace?
You talked about the increase in testing and putting in that STAR request. What does the timeline for that approval look like? And if that is approved, will we get all of those tests at one time? Would it be in phases? How logistically would that work?
So, great question. So Candace, I don't know if Candace is mic'd or not. So Candace's question was, what's the timeline of that STAR request for testing? And would we get it in phases or would it all come in all at once? Well, the easiest part of that, none of it's easy really, but the easiest part is if we could get those reagents and those kits for the machines that we already have, okay? And there's two different types of machine, one at Parkland, different type over here at UT Southwestern. You maximize the machines, together that's 2,940 more tests a day, okay? So that'd be like phase one, just maximize the machines, right? Or if you don't have the reagents currently for one machine, but you do for the other, it's 1,500 more at Parkland or 1,440 more at UT Southwestern. And then, which of these machines can you get at UT Southwestern? There's one machine that can bump you up to 3,000 a day at UT Southwestern. You need another two machines to get you another 2,000 a day. So, any of those machines would, whether it comes in pieces or all at once, it would obviously dramatically help. And you need that for two things. As you move into these, testing is good no matter what, right? But as you see what's happening here, to a lesser extent, because we flattened the curve quite a bit, but if what happens everywhere else this thing has been happens here, which is it disproportionately affects people of color, it disproportionately spreads in neighborhoods without health coverage where people don't normally go to the doctor. And remember, that it's spreading through probably all the neighborhoods in, some degree, but for a lot of people that are asymptomatic, they don't even know they have it, right? If it hits people with 2 or 3 comorbidity factors, they're less likely to be asymptomatic, and they're more likely to have a bad outcome. So it's not like the disease is like searching out a certain person. It's just if it finds 10 people and 2 of them have diabetes, the chances are high that it's the 2 with diabetes or the one with the heart disease that ends up in the hospital. Okay, and so that testing helps us to get on top of that and find people. You then find those asymptomatics, right? Get people separated so that it doesn't spread as quickly through those places where folks are uninsured and where folks have more comorbidity factors. And so we, it's like everything else, we need it yesterday, but if we get it in the next few days, it'll be such a better outcome than if we don't get it in the next few days.
In regards to the machines, you said you'd pay for them if it would be sold to you. What's the obstacle in getting them sold to you?
Well, so as you can imagine, the types of machines that UT Southwestern needs, so does everybody else in the world right now. And so it's moving up on a list. But UT Southwestern is ready to take a big step towards becoming, for our region and our county, first and foremost, but then our region, what the University of Washington was for first Seattle and then virtually all of Oregon as they went through this. And that is a homegrown super test site. They can do thousands a day and do them quickly. And that's the sort of visibility that you need. You're looking for 2 things, really, Andrea, that would make a huge difference right now on this concern of as it moves into the communities with people with high comorbidity. You're looking for something great to happen at the federal level with Dr. Fauci and all those teams, where they create some test that can be rapidly manufactured and sent down. And so that's one thing, and that may happen, but we can't put all of our eggs in the basket of maybe the feds will find some test that's different from the ones we have now, right? So what we're doing with UT Southwestern and Parklands, we're saying, if the silver bullet magical test doesn't appear soon, and it may, there's talk that they may do that, we're ready to invest heavily, to step up, to do what we need to do to make our own University of Washington response, which worked so well, by the way, for Seattle and for Multnomah County, or Snohomish County, I beg your pardon, Snohomish County, one county north of it. So we're ready to do that here, but we need those reagents and those kits specific to each of those machines. And then secondarily, at UT Southwestern, we need some more machines.
Judge, can you speak to are the AAC and Ellis Davis, are they maxing out early every day? I know we get a tweet ever so often, AAC closed at 2 o'clock instead of 8 o'clock. Is the need for more testing because these two sites are maxing out well hours before they're due to close?
So we need more testing, full stop, period. The question, the Casey's not Mike. So Stephen's question was, do we need more testing because AAC and Ellis Davis are maxing out? And we need more testing, full stop. Yes, they are maxing out, but even if those had 500 a day in it, you would need more testing. We are the second least tested state in the union right now, okay? And so we've got to have more testing. Testing is important to kind of catch this virus before it spreads more. And then it's also important, people are talking about, well, what's the plan to reopen the economy? Well, you can't reopen the economy till you're on the downside of the curve. But when you reopen it, you've got to have a huge amount of testing around that, so that as you open up sections of the economy, you're testing all around that to make sure that you don't have a second wave that puts you back into everybody in their house again, right? So you need to constantly build that testing capacity. And these little drips that we're doing, like keeping the important drips, but little things like keeping the AAC up for an additional 30 days and then adding another 30 days on top of that in Ellis Davis. Those are important too, but we've got to dramatically increase both the number of tests and the speed in which we get back the results to have our best chance to beat the virus in this next phase.
The mayor of Houston has said that they have doubled the tests being done at their drive-through sites, and as a result, they're now ready to test people without symptoms. Are you still looking at trying to get the drive-through sites testing increase, and are we anywhere near close to the point where asymptomatic people will be able to be tested there?
And that'd probably be, Dr. Wong, do you have an answer to that, or?
Absolutely. The increased recognition of asymptomatic transmission is important. It's a lot now for even our, outbreak control and investigation and the situations in nursing home and these other settings, having that capacity to do more of that testing. And so it's, so we'll be able to do more asymptomatic, but then also as the antibody tests develop, also to start to see, who has developed antibodies to this, who has past history. Some of those are going to be complementary also, and that's some of the discussions with UT Southwestern on using this to start getting a handle on what really has been the level of infection in our community and those sorts of information too.
And Dr. Wong, you talked a little bit about the antibody test and that being supplementary, but how critical is that, or is it critical at all for testing, I guess, on the front lines? Is that a backup, or?
It is not useful for diagnosis, but again, as we're looking at assessing, again, who's people who might have been already infected, those sorts of information, really getting a sense of what's the level of infection rate in our community, that will be helpful for that.
Dr. Wong, is the 10 deaths that we saw today, is that an anomaly to see that high of number, or is that something that we may see more of in the coming weeks?
Again, it reflects some of the probably, infections 10 days a week, 2 weeks ago, something like that. So it's certainly possible that we may see more of that. This is, what's been seen in some other communities, that increase in deaths. So, this is what we're, the very serious part. This is what we're all trying to address and keep that down as much as we can.
Did 10 deaths take place in the last 24 hours? I mean, when we get these additional deaths that are reported on a given day, I'm just curious. I know we had Easter and the weekend, and sometimes with the case reports, they go down. I think Sundays and Mondays tend to be low. But in terms of the deaths, are those all within the last 24 hours, or when it's reported out? What time period are we looking at?
As soon as we're getting the reports. So that's, I don't know each one what the time of death was or something, but we're reporting them as soon as we get these reports.
How are you all handling contact tracing as these cases are coming out, and how are the resources for you?
We are still doing contact tracing. We've talked about, and as we got to the mitigation and the policies that that might take over, but our staff have been working 7 days a week, late hours, through the weekends. We've got volunteers from the medical school, others that are helping to do this contact tracing. I think it was something like over 150 persons that are helping us to keep up doing the case interviews, the contact tracing, all of that. So we have not let up on that at this point. We're trying to continue that.
Dr. Wong or Judge, do you have an update on, I know tomorrow is kind of that end of that clock for the updates from the hospitals in reference to deciding what may be done with KBH. Was there any update from the hospitals that you guys received today as to an indication?
Yeah, the question was, did we get an update from the hospitals as far as an indication? So, what we received, we did receive word from the hospitals that based on their models and the great work that you were doing in following those models, that they believe that they will have a sufficient bed capacity to handle the surge within their facilities. Now, we don't want to lose the great asset that we have for Texas in these military doctors. So I talked to our partners in the military about that after we received word from the hospital, as well as the governor's office. And right now, the request to the military from the governor and myself is to keep those doctors active in the hospitals where they are now, and no matter what happens, not to lose that asset here in Texas. But that is good news, that the best guess is that we won't be standing up KBH with the military, because they'll be able to handle their capacity within the walls of their hospital, because those hospitals are state-of-the-art, hospitals, and nothing against our COVID step-down unit, but it'd be something we're setting up to supplement those great hospitals.
Emilio here from Telemundo, sorry. People are trying to get a sense of a timeline as to when we are getting back to normal. When we see the curve peak, are we looking at the same amount of time that took us to get there, to get back to normal?
It's hard to say. There's not like some secret information that we're not. So the question is, when are we getting back to normal? And the answer is, there's not like a secret that someone is holding out on you. It's the models are changing every day. You've got Medical City, UT Southwestern, Baylor, and PCCI, and perhaps others that are doing models looking at this. And what we'll be able to tell is if we reach our peak, which is currently late this month or early May, reach our peak and we begin to come off of that, at some point, and we're blessed because we don't have to go first. Others have done this, right? At some point, we'll get to the point where the medical community will be able to say to the people working on this in the business community, we think we're ready for that first section of workers to go back. And so, for instance, the team I've got working on this, they're looking at documents from the American Enterprise Institute. The doctors were working on models on this stuff today. And so we're already working on this. But as far as when it happens, it depends on the situation on the ground. And we just don't know. And it's dangerous to speculate, right, because it'd just be a complete wild guess. Any last question? I want to be respectful of your time
I
because.
got another question on
Yeah.
a different topic. We're seeing some child deaths in Tarrant County. People are staying home, and we're seeing all these helplines that are being shared by police departments like Dallas. Are you getting any reports of domestic violence cases, child abuse? How are we making sure that these cases are being investigated?
Yep. So the question is about child abuse and domestic violence. Two things on that. One is we are seeing an increase. We're seeing a 6-fold increase in child abuse and domestic violence because people are at home, they're out of work, they're hungry, they're scared, and sometimes that leads to bad things. I would remind you of a couple of things. We have people standing by to help you if you're feeling overwhelmed. And you can go to DallasCountyCovid.org, maybe we can get that up on the screen. There's a phone number, free of charge, for you to call to talk. If you have stress, if you have anxiety, if you're feeling depressed, down, suicidal, like you're going to lose it and punch somebody, all those you can call and somebody will talk through with you. Let me say one other thing to those who would hurt their family. If we are down to our last police officer, you are the person that we're coming to get if you hurt your family. So, there will be, we want to have grace towards everybody in a very difficult situation. But if you hurt your family, what we will give you is not necessarily grace. So I would just encourage people, both, we're here to help you if you need someone to talk to, and, God help you if you hurt a child or your family.
Do you know if social workers from schools are still available to help out with those cases? And when you said an increase, you meant increase on child abuse? Is that what you meant?
Yes. An increase in the cases that we're seeing. So, by the way, another good charity to support is the Dallas, is DCAC, the Dallas Center, and I'm going to screw up their name. Guys, Dallas Child Advocacy Center. That's our place where the kids go after they've been hurt to be interviewed and to get counseling and help. So Dallas Center, oh gosh, I just did it again. Dallas Child Advocacy Center. Sorry, I need more tea. It's been a very, very long day. Dallas Child Advocacy Center. And that is Dallas, probably at DCAC, probably, to give to that charity. And with that, okay, somebody has a question. Last question, since you're doing the praying hands. Last question. What is your question?
With the STAR request, with Dallas in particular, Dallas County we're starting to see, I guess, a flattening of the curve. Do you get a sense that North Texas is a priority, and that you're actually going to get that we're going to get what you asked for? And then my second question is, with the step-down facility, are you scaling back your requests for that as well?
Okay, so there's two questions there on our last question. One is, are we sensing with the testing that we are a priority? And the other, are we scaling down our request on our STAR request? Okay, so on the first question, well, let me take the second one first. We'll work closely with the governor's office on exactly what that looks like. Again, we don't want to lose the asset here locally because you're doing great work in the hospitals, and we don't want to lose the asset for the state of Texas. So we're working, land communicating on that thing. On the testing, we've had some good conversations with our Health and Human Services partners in D.C. And it is noted that although we were slated on March 22nd to be one of the next hotspots, we moved aggressively into Safer at Home, and now there are, as they put it, fires around the United States that are bigger than ours. And so that blessing may put somebody else ahead of us for some of these reagents. But we do still need them. We're the 4th largest metro area in the United States, and we are fortunate. It doesn't feel fortunate when you talk about 10 people dying, but we're fortunate compared to the 3 ahead of us, the 3 more populous, Los Angeles, New York, and Chicago, and we're fortunate compared to the ones behind us, Detroit, Miami, South Florida. But at the same time, that doesn't mean that what we're in is not real and it's not affecting a lot of people's lives. And so I would just encourage, when you're talking about the 9th largest county, the 4th largest metro area, we need those reagents. We need that increased testing. And, we'll just keep asking our federal partners, who've been great, but we really need that. I thank you all for your patience with us today. Sorry I was running a little bit late on that call with the state. And everyone stay safe out there, and God bless you all. Rebecca, you want to do all in Spanish?
Yes.
I think people remember because